International travel has turned local epidemics into a pandemic spanning the globe. Just 3 months ago, CAPS started in South America, but has now reached several countries with more than 30,000 cases and nearly 2,000 deaths.
Good morning, and thank you all for being part of this Pandemic Emergency Board. We're at the start of what's looking like it will be a severe pandemic. And there are problems emerging that can only be solved by global business and governments working together. The global community has been working to respond to this pandemic since its recognition, but as health and economic impacts have become more severe, the World Economic Forum has convened this board because of your combined expertise, your backgrounds, and your global voice. We will need all of you to help us respond to urgent policy crises that are emerging. The purpose of this board is to advise leaders in national governments, global business, and international organizations on the response to the pandemic, particularly focused on international problems that require collaboration between business and government. Your recommendations will be critical and will be promulgated and communicated broadly at the end of this meeting. On the left screen, as we have this meeting, you will find a dashboard of information about the pandemic that will help us in our conversations. As important background for this discussion, we want to start the meeting by viewing this news story that just aired on Global News Network.
Continuing our coverage of the newly discovered CAPS disease and the scope of its deadly outbreaks. There are now more than 30,000 reported cases. Experts warn this may be just the beginning of a global problem. GNN science reporters have produced a video about what we know so far about CAPS, the virus, the outbreak, and the resulting chaos.
CAPS is a novel coronavirus related to those viruses that caused the frightening SARS epidemic in 2003 and the deadly MERS outbreaks in recent years. Scientists think each infected person in turn infects on average 2 more people. This disease is proving more transmissible than SARS or MERS and about as contagious as influenza. Essentially, the cumulative number of cases is doubling every week. At this rate, we can expect to see 16 times as many cases in a month unless we find a way to interrupt transmission. The virus appears to be spreading rapidly in densely populated and impoverished neighborhoods in some megacities in South America. CAPS is a serious respiratory disease. More than half of the recognized cases have required hospital care, creating a huge strain on healthcare systems. The fatality rate is about 10%. For comparison, CAPS is about as lethal as SARS and 2 to 4 times more lethal than the 1918 influenza pandemic, the worst pandemic on record. Even so, some people only exhibit mild flu-like symptoms, not requiring treatment in a hospital. Alarmingly, those people are able to walk around and spread the virus, not realizing they are doing so. Even worse, international travelers have been arriving at their destinations symptom-free, but within a matter of hours, becoming ill. Travel-related cases have blossomed into outbreaks in a number of locations and have quickly grown faster than health authorities could respond and contain them. In other places, physicians have quickly recognized the symptoms of CAPS and have been able to isolate infected individuals and avoid an outbreak, for now. Global public health experts are very concerned about this disease because it appears the virus is readily transmitted through the air from person to person. Essentially, all people are susceptible. Experts agree unless it is quickly controlled, it could lead to a severe pandemic, an outbreak that circles the globe and affects people everywhere. Models developed by leading public health authorities indicate a CAPS pandemic could lead to an outcome worse than the 1918 influenza, which killed 50 to 100 million people worldwide. Given the global population is 4 times larger than it was in 1918, If these models prove accurate, we could be looking at hundreds of millions of deaths over the next year or two.
Okay, now we're going to get a briefing on the numbers and distribution of cases by Dr. Caitlin Rivers.
As you've just heard, the outbreak is very worrisome. The vast majority of cases are occurring in Brazil and other South American countries. However, as you can see on the screen, there have been some spread to Portugal, the continental United States, and mainland China. Our models project that with continued spread in Latin America and predicted spread to additional countries, we could be looking at double the number of cases in 1 week and 16 times as many in a month if we are not able to stop the spread. That would be on the order of 500,000 cases, and it would continue to rise exponentially. In 3 months, we could be approaching 10 million cases. We are also tracking financial markets as an indicator of the economic impacts of caps. While markets are down worldwide in the past couple of weeks, they are still positive for the year.
Thank you, Dr. Rivers. The first emerging policy crisis for which we need this board's recommendations regards global allocation and distribution of medical countermeasures. And by medical countermeasures, we mean vaccines, drugs, and diagnostics and other medical supplies to help us combat the CAPS pandemic. I know we would all agree that if we had a vaccine in hand for CAPS, it'd be a game changer. But leading vaccine experts say a vaccine in the near term is highly unlikely. But there is an antiviral that does look like it will work. And to understand that better, we're going to watch one more clip here.
Continuing our CAPS disease coverage and possible solutions, I'm joined by immunologist Dr. Yvonne Bello and Dr. Rhea Blakey, an epidemiologist, both highly respected in their fields. Let's get right to it. Why are people saying a vaccine for the CAPS virus is not likely in the near term?
Researchers are working on a vaccine, and we have viable leads, but it's complicated. We have known about CAPS-like viruses in animals and people for decades, but have not been successful at developing a licensed vaccine. And sure, there are new technologies that may help, but it's going to be difficult. I am not optimistic about having a vaccine in time to be relevant during this pandemic. Even if we discover a good vaccine candidate, we're starting from scratch, and it takes time to test safety and efficacy, typically years. So even if testing moves quickly, global manufacturing will still need to be established. Again, multiple hurdles.
We simply cannot rely on these old timelines and processes. This is a crisis. We have to move beyond these issues. It may be complicated, difficult, but if we dedicate all available resources, this can happen. Also, keep in mind, we need effective treatments sooner rather than later. Extranavir is an antiviral drug. Scientists have told me this could be effective. We need to start treating people immediately.
While I agree Extranavir does look promising, it's currently used for treating HIV. However, it's not manufactured on the scale needed for treating this many people. And will we just stop using it for HIV treatment? How will we get this drug in the quantities needed? Who decides who has priority for the limited amounts we do have? We both know countries are hoarding Extranavir.
Doctor, in my opinion, you are lost in the details. With enough money and political will, anything is possible. Let's get going on this now.
Thank you both for this extremely important discussion. Our U.S. affiliate has just released polling results on public expectations for a vaccine. A majority of Americans expect a vaccine to be available within 2 months, and 65% of those polled are eager to take the vaccine, even if it's experimental. In related news, a significant demand for personal protective equipment like N95 masks and gloves are on the rise due to the pandemic. However, globally, hospitals are running low. Additionally, other critical medical supplies such as saline and antibiotics are dwindling. Countries and companies are reportedly stockpiling supplies, disrupting healthcare supply chains, causing dangerous shortages in many parts of the world.
And finally, for the latest information on what we know about vaccines and this antiviral, here's medical countermeasure expert Matt Watson.
As we've just heard, there is no existing vaccine that appears effective against the newly discovered CAPS virus. Governments, scientists, and companies around the world have become working intensively to develop one, but it's highly unlikely that a vaccine could be developed, tested, manufactured, and distributed in less than a year, and it's likely to take much longer. While there have been efforts to develop vaccines against SARS and MERS coronaviruses, none have been licensed. And given the distinctions in the CAPS virus, vaccines against those diseases would not be effective for CAPS. The antiviral drug Extranavir has demonstrated some efficacy against the CAPS virus. It reduces the severity of illness and saves lives in those who are infected, but does not prevent infection like a vaccine would. Extranavir is a generic drug primarily used to treat HIV. It is manufactured in 5 countries, including the United States and China. Approximately 1 million people take Extranavir every day for HIV. If all of those HIV patients could be switched to other antiretroviral drugs, we could potentially free up enough Extranavir to treat 26 million CAPS patients. Assuming further that we could double production over the course of a year by bringing additional manufacturing online, we could eventually have 52 million treatment courses per year, but it will take many months to get there. And there is not likely ever to be enough to keep up with the need as long as the disease continues to spread at this accelerating rate. Experts agree that while many lives will be saved by this antiviral, it is not going to slow the pandemic in the same way a vaccine could if we had one available. However, we do have the potential capacity to save many people. Now the question is, how do we distribute the supplies we have? Existing global supply chains and logistics networks for Extranavir run efficiently under normal conditions, but the pandemic is likely to be very different. We are hearing that one country where Extranavir is produced is planning to block some or all of the export of this medicine to hold on to it for their own people. Tensions are rising between governments and pharmaceutical and medical supply companies about how supplies should be allocated and who gets to make those decisions. International humanitarian organizations are raising serious concerns about access to antivirals for people in low and middle-income countries. In addition to antivirals, other medical supplies are not reaching those who need them in many parts of the world. This is especially pronounced in low and middle-income countries, which are reporting the highest rates of disease transmission and mortality. In part, this is due to last-minute stockpiling and hoarding by customers, and in part, it is due to cost and logistics issues. Personal protective equipment, such as N95 respirators, are in critically short supply in some areas. N95 respirators are manufactured by many companies around the world, but there are no reliable estimates of how many are produced or what global production surge capacity is. All we can say is that production capacity covers normal demand, and it is not uncommon to have temporary shortages during severe flu seasons. In a severe pandemic, we can expect the need to increase by a factor of at least 2 to 3. Given these supply issues, there are a number of potential proposals being floated aimed at coordinating and facilitating medical countermeasure allocation and delivery around the world. Politicians, business leaders, scientists, and policymakers are weighing in. Some are suggesting that suppliers and buyers continue to work independently to decide where to send antivirals and medical supplies. Others are suggesting that countries where these products are made should be able to decide where those drugs and supplies go. Still others are recommending that suppliers, buyers, and countries entrust a central international entity or organization with the job of allocation and distribution decisions for at least a portion of antivirals and other medical supplies.
Thank you, Mr. Watson. So the policy crisis in question for this board in this meeting is this: how should governments, business, and international organizations allocate and distribute pandemic antivirals and medical supplies to the people who need them most? We now have time for discussion about this matter. This is the focus of this meeting. Any reactions? We have too few antivirals for the needs that we have, and we're projecting to have increasing needs. So should we let normal suppliers and buyers manage the distribution and allocation of this medication?